is National Stroke Awareness Month, but most people don't even recognize the warning signs. Suzanne Whitaker is an American Heart Association Circle of Red member and a People's Health spokesperson, and Michelle Martin is a stroke survivor. And tonight we're talking about why it's so important to know what a stroke is. Thank you so much for both being here. And Michelle, I want to start with you because we often talk about numbers and statistics, which are important as well, but it's kind of hard to identify with if you have never had a stroke yourself or don't know someone who's had one. So kind of tell us your story. When did this happen to you?
In September of 2010, I was gardening in my backyard, and I got this intense headache that immediately made me extremely nauseated. And I just had a feeling I knew something was wrong. And I managed to walk back into my house, and it was difficult to walk. Got back into the house, I sat on the couch, and then fell on the floor because I couldn't sit erect. I was home alone. My husband was at Home Depot. He came home within a couple of minutes and found me on the floor. Immediately, they called 911. I remember being loaded into the ambulance and hearing the EMT say, "Activate the stroke team." When I got to Tulane, the stroke team was already there and waiting for me. I immediately got the TPA drug and spent about 2 weeks in ICU at Tulane. I was then moved to the inpatient rehab facility at the old Lakeside Hospital, where I spent about a month. I then went home to outpatient rehab at Toro. I was there for about 18 months doing rehab. I did speech, occupational therapy, and physical therapy. But my stroke was not atypical because they detected a blood clotting disorder is what I had. I was running 2 miles a day and doing weight training. I did not have high blood pressure. I did not have diabetes.
Wow, so you were healthy and exercising.
Yes, ma'am.
And did you know what a stroke was or the symptoms? Did you think I'm having a stroke before you heard them say that?
No, I knew something was wrong though. This headache was like nothing I had ever experienced before.
Wow. And so Suzanne, when she says that, she doesn't have the typical risk factors, but we talked about that some people have no clue what a stroke is or how to recognize it. Now, her case is different because she did have that rare blood disorder that made that happen. But talk about what are the risk factors people should be looking out for?
Sure. Well, because we live in Louisiana and we really enjoy our food here, we also do suffer some consequences because of that. You should be aware of eating too much salt. And if you start having fluid retention, or if you're having issues with high blood pressure, especially from diet, that may be something to look into. Also, if you have family history of heart disease or stroke, that is also obviously an identifying factor that you can talk to your physician about as well to see if you might be subject to the same diseases. Okay, and you mentioned food in Louisiana there. When it comes to the numbers, Louisiana not looking so good when it comes to stroke or heart disease. That's right. We actually continually rank 49th out of the 50 states in healthcare outcomes. So that's not a very pretty picture right now for us. But that mainly has to do with, again, our lifestyle, our food, and our lack of exercise. And those are some simple things that we can change that can help increase our numbers to the better for heart disease. All right, and Michelle kind of talked about in that moment what it felt like when she was having a stroke. What are the signs that people should be able to recognize? Because I understand that response time right after is a big factor in how people recover. That's right. Well, it's interesting. Stroke and heart disease may be experienced differently between men and women. Okay. Men usually have more typical symptoms where they have the pain in their chest and they feel a heaviness on their chest. Many more women have issues with back pain and, like she said, headache, and we're more likely to just put that aside and think that that's just normal discomfort. So as a woman, pay attention to that. As men, it appears that they have the more typical issues with a heart disease, with a heart attack and stroke. Okay, and Michelle, when it comes to recovery, sadly a lot of people don't take these things into consideration once they actually go through these things, and it's a reality. But I know that going through a stroke can't be an easy thing. Kind of talk more about what that recovery process has been like for you and how it's changed your life kind of permanently. Well, I had excellent therapists at Toro and Tulane. I owe a lot of this recovery to them, and I have a wonderful support system at home.
My husband works with me every night. I also have a wonderful support system around the house. I have a little neighbor who's 10 years old and comes over, and she gardens with me, cooks with me, does anything I need with me.
Very sweet.
I also work out at the local high school football field. I walk the stadium steps, and I go to the Chalmette battlefield and walk on the levee. So it's all about just keep active and keep pushing, keep doing what you need to do, and not staying in the moment and thinking of how much you have lost. I am very thankful that I am able to drive independently. My speech has not been affected. My eyesight is not affected. I was able to go back to my employer, where I just made 29 years of service, so I kept the same job. I'm looking forward to retirement in about 10 years. It's not a lot of stroke patients who are able to go back and return to these things. So,
well, you look
very
beautiful
fortunate
and are recovering very well. We're very happy to hear your positive story. And quickly, Suzanne, I do want you to mention the Heart and Soul Gala, which is coming up in June.
Yes, we have the Heart and Soul Gala scheduled June 7th, Saturday. Tickets are $250, and if people are interested, they can go to heart.org and find out more information. We're going to have a live auction, silent auction, gourmet dinner, and dancing.
All right, a great night there. Again, thank you for being here, Michelle, and telling your story, and Suzanne for all that important information. The American Heart Association's Heart and Soul Gala we just talked about is Saturday, June 7th at the Morial Convention Center. Things are going to kick off with a silent auction and cocktail reception at 6 o'clock, and then at 7:45 there's dinner, dancing, and a live auction. And for more information, you can visit heart.org.